Good afternoon, everyone, and welcome. As most of you know, I'm Craig Snyder, the president of the World Affairs Council of Philadelphia, and this is the launch of our new series of webinar programs. After 71 years of doing these events the old-fashioned way, Mother Nature told us to try something new, so here we are. I can't tell you how grateful all of us at the Philadelphia Council are for your participation in this event and for the commitment to the Council's mission of civil and civic discourse, which your participation here demonstrates. I want to give a special thanks to those of you who used our Pay What You Want button for this event, because even digitally, there's no such thing as a free lunch. We have several hundred people virtually gathered for this discussion from 25 states and Canada. It's practically another Continental Congress organized in Philadelphia, except this time with children's pets and maybe some pajamas. This afternoon, as you know, we're joined by two of our country's thought leaders on issues of political economy with differing points of view to help us think about the current enormous economic difficulties facing our country and indeed the world, and to give us their views on the best paths forward. I'm going to quickly go through the format for the event, but please use the question bar if you have any issues. Our Vice President for Programs, Haley Boyle, will be available behind the scenes to help you with any questions that you may have. And please be patient with us. As I say, this is the first outing with this new format. There may be a few bugs, and we appreciate your understanding of any issues that we do encounter. Here are your only instructions for later in the hour when we have the opportunity for some questions from the audience. To ask a question, you should use the raise hand button, and if your question is selected, I will announce your name, and then you'll receive a prompt to unmute your microphone, at which point you'll be able to ask your question and be heard by everyone in attendance here. And then you'll be muted once again at the end of your question. So we've asked each of our panelists to make just a couple minutes of opening remarks. Then we'll move to a conversation among the three of us. And after that discussion, we'll have time for your questions. So with that, let me introduce to you Robert Kuttner, co-founder and co-editor of the American Prospect, and Peter Goettler, the president and CEO of the CATO Institute. Bob, take us away.
So the question that was posed is, what's the path to recovery? I don't think any serious economist believes that we're going to be able to reopen, in the jargon, the economy anytime soon. Clearly, the strategy of self-quarantine to flatten the curve, slow down the incidence of infection so that hospitals can keep up with infection, paradoxically helps us get through to a recovery faster. Because if you have people getting sick, as has happened in meat processing plants, you're going to slow down the recovery. The idea that we're going to be in recovery by the second quarter, which was initially, I think, proposed by some people in the business community, I don't think anybody believes that anymore. It's also the case that there's going to be a regional dimension to the recovery. Some states that have not had a serious incidence of infection, they're going to be able to move into recovery faster. This is certainly a moment for federalism. The fact that the governors are taking the lead on this, some of them very skillfully, that's entirely appropriate. So this is not going to be a recovery that hits the entire country at the same pace. I also think there's a huge role for government in several different respects. The fact that we have a payroll protection program, that's good. The fact that it's being contracted out to private banks, that's not so good, because a lot of banks are ambivalent about playing this role. It would have been better if this had been done directly by the IRS or the Treasury or the Social Security Administration, government agencies that know how to cut checks and get the money out fast. Similarly, the program for small business not being done nearly as efficiently as it could be done. One of the reasons is that government has been in such bad odor for so long by both parties that the necessary civil service has been stripped of personnel. And so you have SBA, which under the best of circumstances is one of the creakier of government agencies, suddenly being called upon to increase its activities 100-fold. You have state unemployment services, which have been stripped of employees, suddenly now facing applications for almost 17 million Americans who are out of work. So government needs to step up even more emphatically and more efficiently than it has. And I think in the second phase of this, as the private economy is getting back on its feet, you're going to need to see public works, public investment, public infrastructure, which has also been stinted on. This is a good time, once it's prudent for construction workers to come back to work, for government to make these long deferred investments. So this is going to be a slow process. I think maybe by the third quarter, we'll see the economy getting back going. It's not going to be a so-called V-shaped recovery because a lot of businesses that go out of business during this collapse are not quickly going to come back into business. Wall Street has gotten the lion's share of relief from the Fed. More of that relief needs to get out to Main Street. So I think this is a multifaceted process. We should not be holding our breath to have this happen anytime soon. If we get very lucky with the incidence of infection, this could be starting to happen, say, by fall, maybe even sooner in some sparsely populated and not terribly badly infected regions of the country.
Thanks, Bill. Peter.
Craig, first of all, thanks to you and the World Affairs Council for the invitation. Thanks also to the contributors who are listening, the World Affairs Council contributors, for making this forum possible. Much appreciated. And also, I just want to say briefly to all the folks out there who are dealing with the current challenges and inconveniences and worse. I know many of you have sick loved ones or have been ill yourself, loved ones that have passed away, loved ones that have been, and friends who have been dramatically impacted by the economic dislocation. And you know, our hearts go out to everyone who's been affected. It's really been quite an incredible time. I think that it may surprise Bob. We probably agree on some things. It's been interesting to me that I think I'm going to leave a lot of specifics to the discussion, Craig, because you've indicated there's some things you want to ask about. When you're faced with a challenge like this and a crisis as a nation, you know, I think our history has been to put politics aside, and one becomes hopeful that in an environment like this, maybe the tribalism and partisan recedes a bit. And it really hasn't been the case. And in this environment, we really need to be driven by facts and reason and analysis. And unfortunately, I've seen, particularly as it relates to this issue of reopening the economy, it really has been drawn along partisan lines. And I don't want to generalize too much, but I will share with you what I've heard from folks both on the left and the right. You know, there are people on the right who have told me they just don't think the virus is a big deal, no worse than the seasonal flu. And we've got, you know, we're incurring tremendous economic costs, so we really need to get the economy reopened. I've heard from folks on the other side, and I guess being an unaffiliated voter, it's a little bit easier for me to, you know, I've broad areas of agreement and disagreement with both Republicans and Democrats, but it's been much, you know, reaction of, hey, we just have to stay locked down as long as it takes, and you know, there's almost a feeling of that to equate that when we talk about reopening the economy, we're trying to equate lives and dollars. And I really think that the picture is, you know, more complicated than each of those. I think the virus is pretty serious. We're hampered by a tremendous lack of data, lack of testing data. We don't really know how serious it is, but it's a good bet that it's much more contagious than the seasonal flu. It appears that the mortality rate, even though there are estimates all over the map, and we have terrible data on this, is higher than the seasonal flu, and we don't know know how much higher. So it's a serious problem. So some reaction of non-pharmaceutical intervention has been necessary, particularly with respect to the objective of not allowing the healthcare system to be overwhelmed. But I also think that the economic, calamity that we've witnessed does have real consequences for people. I don't necessarily buy into a lot of the arguments that are made that there will be deaths from the virus and also deaths from a contraction in the economy. Clearly, a contraction in the economy will impact public health. It'll have general impacts on health. There's not a lot of data to support the idea that the economic contraction will create a lot of death, increased mortality in and of itself. In fact, there's a lot of indicators that suggest otherwise. But when you consider the cost that has been taken from folks who have had their life's work wiped out, people who have lived the American dream and now are seeing that evaporate, people who have not lived the American dream, who are among the most vulnerable and least fortunate in society, have lost jobs and livelihoods. So I think that it's very important that we recognize that these tremendous economic costs we're bearing do have real impact on people in our country and our communities. And so I think it's important not to minimize that. So I think it is important to try to achieve both objectives. There's been this, it's evolved, I think, largely for partisan reasons into an idea that there's this trade-off between the economy and the virus. And I think we do have to be serious about combating the virus, but we also have to take the steps that we can to recognize that we can't stay shut down indefinitely. I tend to be a little bit more pessimistic about the intermediate term path of the economy, just because I think trying to control the virus is going to be with us for a while. I think part of the reason people have been of a view that, hey, we just have to stay locked down for as long as it takes, is that they've been living on the myth that once we get through some period of weeks, the virus will be handled. And I don't really think that's going to be the case. As soon as we do start returning to life in small steps to life as normal, it's possible the virus will be spreading again. So we have to be careful of that. I really think that we need a much greater focus on testing, building our capacity to mass test, because that's going to be important to get people back to work. I don't see as much focus on that in the public sector as I'd like. We hear anecdotally positive things happening in the private sector. And I think we also have to recognize that we need to, as soon as we can, allow businesses that can operate safely to get back to work. I think that the focus on essential, non-essential has shortchanged us in two ways. One, there are businesses that are so-called non-essential businesses that can operate safely and should be allowed to operate. And also, by not focusing so much on the safe operation of businesses, I think some of the essential businesses we've not focused enough on allowing them to adapt. And we're beginning to see that, for example, in the grocery context. We see innovation and changes in operations that can allow employees and customers to be safe. I know Bob and I will have very different points of view on the role of government going forward in dealing with the economic situation.
Thank you. All right, so let's turn to a little bit more on that issue of government economic policy. But I still want to kind of level set for a second and ask you each to do some predicting here, recognizing all the data is incomplete. How deep do you think this downturn goes before there is the beginning of a recovery, whether that recovery is V-shaped, U-shaped, L-shaped in terms of velocity and duration? But how deep are we going to go in terms of job losses, in terms of reduction in GDP? Anybody jump in?
Well, it would seem to me that you're going to have a reduction in output in the range of 20 to 30%. That's depression level. That's not going to last for 8 years like it did during the Depression, but it could last for a few quarters. You're probably going to see another 6 million people file for unemployment compensation this week, as did last week. So the unemployment rate could go to 20% or even higher. But the good news there is that this time government has stepped up to the plate fairly quickly. It's not been very effective at getting the money out, I think, again, because government has been stripped of resources. But at least because of the whole Paycheck Protection Program, people are not going to be destitute. So that's the order of magnitude. Let me say one other thing. I think the way we're going to get the economy back on track is by massive testing. One of the things and Peter and I probably agree on this, one of the things we don't really know scientifically is whether people who've had the virus acquire immunity for a prolonged period of time. And epidemiologists talk about herd immunity, where a sufficiently large fraction of the population has had the virus, and at that point, the virus runs out of people to attack. And that's the point where things start getting back to normal, and you don't have to worry as much about second wave and third wave infections. I think we probably agree that the economy is going to get back to something like normal sectorally and regionally. But to rush that is to defeat the purpose.
I think, 30% contraction in the second quarter, which would be, probably the worst ever, is kind of on the order of what we're expecting. But I'm really relying on the kind of expert macroeconomists. There's about 30% of the economy that seems to be shut down, kind of an 8 to 10% absolute contraction. I think that we do agree on testing. And this is, again, an area where I think we all have to have a bit of humility in this situation about what we do and don't know about the virus, and what we do and don't know about what we're talking about. I think that there clearly has been very heartening response by the scientific community, the healthcare industry. I was on a conference call over the weekend when there was a professor at a research university that described a program they had underway where they were confident they had developed a rapid antigen test that could give a result as to whether someone's infected in 5 to 15 minutes. They think they can produce 100,000 of those a day. They said there's a company overseas that thinks they can produce 4 million of those a day. So their vision is, you show up for work, you get tested. And if you're in 5 or 15 minutes, they know whether you're infected or not. If you're infected, you go home, you're quarantined. If you're not, you go to work. I don't know whether that vision is with respect to the raw materials needed to produce the tests, the efficacy of the tests, but I know that there are, that vision, that energy is being replicated all over the country, and it actually is something the response of our scientific community and those in the healthcare industry, I think, has been very heartening in that regard. I typically think that when you have a cathartic event like that often tees you up for a rapid economic rebound. But I think what is going to inhibit that this time is the whole idea that we're not going to vanquish the virus in a month. We're going to be living with it. We're going to have to do mass testing. We're going to have to be tracking people, which we think is important to be done in a way that's consistent with privacy. And I believe that the work that Apple and Google are doing is very heartening in that regard. But that we're going to have periods where there'll be rolling, hotspots, resurgence and spread of the virus in certain areas, which is going to necessitate, a potential curbing of certain businesses. But also, I think it depends upon how ubiquitous the virus remains, because obviously, one of the things that we also saw throughout this episode is private individuals and private businesses pulling back. The sports leagues were not mandated to close. They did that voluntarily. We were not ordered to send our employees home, but we did in the interest of their safety. And it's going to take a while before people are comfortable being at a sporting event, being in a theater, being at a theme park, et cetera. I think there's a lot of hope as well in addition to testing. I think I have less certainty over a vaccine. Again, I don't pretend to be an expert, but experts I talk to say that the 12 to 18 months, yes, that's reasonable, but far from certain. I think that the near-term hope would be a combination of testing and hopefully the emergence of some effective treatments that will curb the mortality of the disease and let people live in a way such that the infection, doesn't carry the same consequences that it might today.
So let's go to what I think is the core of the discussion for both of you, and that is proper government policy. And I guess one would presume that the goals for policy would be to sort of raise the level of the bottom that we hit, right? Make the floor be as high as it can be, to leave in place for the recovery as much business infrastructure as possible, so there's something out there to rebound, and obviously to help with the quality of life of ordinary Americans throughout the difficulty. So my question is, in terms of those goals, do you think that the right things have been done so far by both the political branches and by the Fed? Or for each of you, would you have done or now be doing other things, more, less, different? And Bob, we'll start again with you.
Thanks, Craig. One dimension that you didn't raise explicitly that I'd like to raise is the disparate effect of this economically on different categories of people. So the three of us are professionals. We can work from our home. It's very pleasant. A lot of so-called essential employees, people who work in warehouses, stocking Amazon or Walmart, or people who deliver packages, or people who have other not very glamorous jobs, tend to be lower income people who are not well compensated to begin with, who are then asked to take even greater risks with their health than we are. I think when we come out the other side of this, more attention should be paid to those people who are putting their lives on the line to serve the rest of us and their livelihoods. I also think that at the other end of the income spectrum, the Federal Reserve is probably going to end up increasing its own balance sheet to $9 trillion before this is over. A lot of that is going to bail out bad bets that were made by people on Wall Street during the period of very, very low interest rate and very, very lax regulation that was made even more lax when Trump came in and undid a lot of the Obama era regulation. So part of this is not just recovery on average, but the question is recovery for whom and with what kind of justice and how. So that said, I think the need here is to be more efficient in getting the aid out, both to small businesses and medium-sized businesses. Arts organizations, a lot of arts organizations could go under. And a lot of the small businesses that I think both Peter and I revere as the backbone of America, they could go under. And so we need to do a better job with that. And I'm repeating myself here, but I think in phase 2 of this, there's a real role for public infrastructure investment to get a real fire started under the what's left of the economy to jumpstart that. We've let infrastructure go to rack and ruin in this country. If you take the train from Boston to Washington, as I sometimes do, you see a museum of 19th century infrastructure. If there was ever a time to use public investment, both to jumpstart the economy and also to get us more towards a climate-friendly economy, this is the moment to do it.
Peter.
Bob made an interesting point at the outset about how we're pretty comfortable. We're professionals. We're sheltering at home quite comfortably, able to still draw a paycheck and do our jobs. And that is a point that I often think of, particularly when there's discussion about trying to reopen the economy, and they're kind of put down by, hey, you're trying to equate dollars with lives. And I think, again, this gets to the heart of the fact that the economic destruction that's occurred does have real impact on real people. And when folks are lectured by the public health authorities that, hey, you've got to stay at home, there are some folks for whom just doing that is a real challenge. And I think that to me, again, trying to steer this middle ground by control of the virus, but doing what we can to recognize the tremendous cost of so many sectors of the economy being closed, does argue for doing this, making the steps that have to be made. Again, particularly having more of a focus on testing and letting businesses that can operate safely do so. That is one of the things that's been very disappointing in the government response, I think, is I still am not seeing on the part of the bureaucracy or the administration enough of a focus on developing the mass testing capability that is actually going to allow the economy to get back to work. And I do think Bob tweeted last night, I think he mentioned that, hey, it's a tough time to be a libertarian. And a lot of the interventions and the curbs on freedom that are taking place, they are quite painful to someone who sees a much more limited role for government. But I believe in a smaller role for government than Bob does. But I'm not an anarchist. Public health is a legitimate role of government. And one of the things that I would hope would come out of this crisis is not an expanded role for government, but a recognition that we need government with a more modest role. I've felt for much of my life that a government that's trying to focus on everything and do everything beyond what I feel its legitimate roles are does not leave it well placed and competent to fulfill its legitimate and important responsibilities. And I think that the current situation is reflective of that. I think the initial stumble, out of the gate with regulatory impediments to using tests that were available overseas, to have American companies who had tests that could be used in the United States shipping them overseas because they weren't allowed to use them here, is I think again a good example of a government that's spread very thinly and trying to do too much, not being competent in the execution of very important responsibilities and very important roles. And I also think one of the things this highlights is the fact that, when we were all young, our parents taught us about saving for a rainy day. And Bob mentioned some of the interventions by the Fed. In the last crisis, the Fed's balance sheet grew from about 800 billion to nearly 4 trillion. Didn't shrink appreciably over the ensuing 10 to 12 years. We have, in periods of meaningful economic growth, low unemployment, deficits in excess of $1 trillion. And so we clearly haven't kept our affairs in order for the proverbial rainy day that is upon us now. And I believe that not having enough savings, having government that's spending beyond its capacity does leave us in a weakened position when we confront a crisis like this.
So I think we may have arrived at some points of disagreement, and that's more than fine.
Friendly disagreement.
Exactly, friendly disagreement. So let's talk about this sort of unprecedented level of government intervention that we're seeing not only here but throughout the G20. And I guess I have a couple of questions. One is, there are, as you both said, there are many sectors of the economy that don't appear like they can come back for quite a long time, in sports and recreation and concerts, and I mean, you name it. You could go on and make a very long list that add up to millions and millions of jobs. How are those folks going to live? How are those folks going to survive? Are we going to, in your view, and in your view, in terms of what we should do, are we talking about just sort of a simple extensions of the existing unemployment framework? Or do you think that we're going to be talking for the first time seriously about a sort of guaranteed basic income? How do we deal with what could become a large group of long-term unemployed folks because their sectors have just been shut down by this public health issue? That's question number one. Question number two, do you think that these sorts of intervention with income support, both to companies and to individuals, are going to be with us forever? Or is there some sense in which, well, no, they can be viewed as temporary emergency measures and they can go away if quote unquote normal times return? Peter, why don't we start with you on this?
Yeah, I'll take the second question first. I think it's very important that the interventions last only so long as the crisis lasts, particularly those that directly impede our freedom, our civil liberties. And as I mentioned, it is there are painful elements of the current crisis to see such massive, government interventions. As I said, public health is a legitimate government role. Most of my colleagues and fellow travelers believe that as well. Many people have gotten comfortable with the idea of government intervening to provide economic relief in a crisis like this, because there are people who are bearing the burden by closing their businesses, et cetera, of disproportionately bearing a burden of protecting the rest of us from the spread of the disease. And there's some, some fair sense that they should be compensated for that and provided relief for that. There's also been, kind of a theoretical or philosophical approach that the shutdowns are, some form of an eminent domain taking because it's in the public interest and therefore, deserving of compensation. I'm not sure that I accept those rationalizations. The first is certainly, particularly since a lot of the, not all of the economic costs have been created by mandated shutdowns. As I mentioned, many of us had backed away from the workplace. Businesses had closed before they were mandated to do so. So those aren't costs that would be directly, created by the government. I think for me, it's more a sense that we've now created, an ethos where in the midst of crisis, government's expected to step up and intervene. And I think that's one of the reasons that, we see a very strong, reaction in that regard. And so there's a presumption that relief is going to be provided. That is something you can only remove over a long period of time. My problem with some of the interventions is that I do believe that it would be better to rely on, existing programs like unemployment insurance in order to provide relief and ensure that it goes to those who are affected. I understand the rationale for the Paycheck Protection Program. My concern there is I think that there is a lot of money going to people who don't need it. And I think to the extent that we are trying to provide relief, and I think relief really is the way we should describe it, because I don't think in this environment, stimulus, I don't think has a very good track record of working. And in particular, times like this, when there are shutdowns in the economy and supply shocks, spending on stimulus or giving money to people for reasons of stimulus will not likely be very effective. But the idea of mailing a check to every American below a certain income level means that a lot of people who need the relief get it, and a lot of people who don't receive it as well. I think the same is true for the Paycheck Protection Program. There are businesses I know for people who are very well off, who are applying for the loans that can ultimately become grants. CATO qualifies. Certainly, I don't think it's a a role of government to provide funding to think tanks. And we qualify, but we're not applying for a loan, and we've made clear what our rationale is for that. So my concern is that we have blunt instruments at our disposal, and we end up spending a lot of money, and some of it gets to the people it's intended, and much of it doesn't.
I'd like to take polite exception to most of that. First of all, the idea that something called government is to blame waltzes around the fact that we have a president of the United States who lives in a factual universe of his own imagination. And an awful lot of the failed response to this initially, which is continuing, is directly the fault of Donald Trump. So just for starters. Secondly, when you talk about being a libertarian, I'm certainly a civil libertarian. I completely agree with Peter that we ought to be very alert to our civil liberties being taken away. On the other hand, when you think of, say, health insurance, the fact that I have health insurance and don't have to choose between filling a prescription and putting bread on the table, that makes me a freer person. The fact that I have unemployment compensation so that if I lose my job, I don't have to starve, that makes me a freer person. The fact that I have paid sick leave so I don't have to go to the office and infect my fellow workers, that makes me a freer person. So there are a lot of affirmative things that government does that enhance liberty. That's one of my major bones of contention with principled libertarians, recognizing that Peter is certainly a principled libertarian. On the issue of the size of the deficit and saving for a rainy day, the people who obsess about the size of the deficit didn't seem to mind when the Trump administration pushed through a $2 trillion tax cut. It's as if deficits created by government spending are bad, but deficits created by tax cuts for the wealthy are good. I also take exception to the idea that in the $349 billion Paycheck Protection Program, some of that money may be going to people who don't need it. Yeah, that's true. But then compare that with the Fed's balance sheet, which is going to $9 trillion, much of which is to bail out bad bets by people made the people made on Wall Street. And the reason that the Fed's balance sheet after the last crisis stayed up around $3 or $4 trillion is that the Fed bought a lot of junky securities to bail out Wall Street. And if they had tried to sell those securities back onto the market, they would have reduced the value of those securities. So we have to not only look at what's the size of government, we have to look at who government is benefiting. Now, on the specific questions that Craig, you raised, I think that when this is over, the unemployment rate is certainly going to be higher than when it started. And I think some of the reforms that were put in during this crisis so that you're eligible for unemployment compensation, whether you are a W-2 employee, a payroll employee, or a 1099 employee, when you have more and more people working in the gig economy, those reforms are long overdue. The fact that people should get paid sick leave, those reforms are long overdue. And I certainly hope that the politics of this plays out in such a way that benefits that people get during a crisis are going to be very hard to take away when the crisis is over. I think the issue of whether we need some kind of guaranteed annual income, that's more an issue that has to do with how many jobs automation is going to take away. That's a separate variable. I do think that when this is over, sports leagues are going to come back. I hope most arts organizations are going to come back. I don't think you're going to have a legacy of mass unemployment, but I do think you're going to have some unemployment. And if you look at the construction industry, a lot of construction projects that could have gone on were shut down because construction workers use the same N95 masks that health workers use. And if there had been better planning, better control of supply chains, so that we were not so terribly short of these masks, then some construction projects could have continued. So I think the definition of what's essential and what's needed as the economy starts getting back into high gear needs to be fine-tuned almost daily. Construction work, public works, certainly something that we could do to put people back to work. And then I think the question of whether we need a universal basic income, that's something we can revisit after we get through this crisis and come out the other side.
Bob, let me ask you to comment on something that Peter talked about, which is sort of, paying the piper down the road for the level of deficit spending and the level of some of the Fed obligations. Do you agree with the premise that at some point austerity of some sort will be required? Or do you think that unprecedented levels of the ratio of debt to GDP are acceptable and are the right way to go?
Well, I think moving to austerity after the economy is just back on its feet would be the most perverse policy of all. And the Obama administration in 2010 made the huge mistake of moving to deficit reduction before the economy was back in high gear. I think the issue of the Fed's balance sheet is this. Let's separate the question into the size of the Fed's balance sheet and the level of deficit spending. You know, after World War II, the British economy had a debt to GDP ratio of 260%. And the government after World War II, instead of shrinking that and bashing the economy further, it went on an expansionary program. It built the National Health Service and expanded basic industry. So just because you happen to have a high debt to GDP ratio after a crisis doesn't mean that you should go into austerity mode. I think that's absolutely perverse. Now, the question of the Fed's balance sheet is an intriguing question. Imagine that it is the middle of 2021 and the Fed has bailed out everybody in sight, and the Fed's balance sheet is $9 trillion. That's the projection. If you try to sell those securities, much of which are based on junk, and if I'm a hedge fund or a private equity company and I've gone on an acquisition binge and I've paid a lot of money from my debt, and the Fed is willing to trade my 10% junk debt for 1% debt, I'm going to take that deal. But then what's the Fed going to do with those bonds? Who's going to buy those bonds? And unloading all of the junky securities that the Fed has taken onto its own balance sheet is going to be very tricky. There's no logical reason why the Fed can't keep that money on its balance sheet for a long time. I think that's actually preferable to having a fire sale, which then would be devastating to financial markets at a time when financial markets are still fragile. And I think if the federal deficit is high because we've had to spend some money to get through this crisis, the most perverse thing you could do would be to go right into austerity mode. I mean, economists since Keynes have understood that the analogy between the household and the macroeconomy is a very flawed analogy, because the macroeconomy has the capacity to borrow money during crises. The household economy does not. And a crisis is exactly when the government should be borrowing money. And then we should be very careful about the pace at which we pay down that debt so that we don't knock the economy back into depression. That's what's happened in the Great Depression. The government took too long to get the economy back on its feet, and it tried to pay down debt too quickly. The economy went back into recession in 1937 and 1938, and it took the massive spending of World War II, where we were borrowing something like 20% a year of GDP for 4 years to finally get the economy out of the Great Depression. So that's a lesson that we need to learn.
So I want to do one more question, and then we're going to go to our audience. I want to remind everybody, if you'd like to ask a question, use your raise hand button.
I'd just like to say one thing. I'm not going to respond to Bob, but I just wanted to make sure that that things were clear when he criticized the president. I was not here to defend the president. I don't want him to mistake me for a member of the administration. I think I was clear earlier when I said that the public health response on the part of the administration and the bureaucracy, I think, was at fault here. So I just want to give it, and I think we should have maybe another get together at some point, because I think that we're very critical of the Fed, And I think that Bob and I think could have an interesting discussion about that, because I think that there'll be so a lot of areas of agreement, and I think we'll have different areas of disagreement, because I think that we'll both just not like the Fed for perhaps different reasons, but I think there will be some common ground there. I'm certainly not going to defend the Fed.
I was not accusing you of being a
Oh no, I
defender
got
of the
that.
president. My only point was that sometimes what is blamed on government should properly be blamed.
Uh-oh. We lost you for a second, Bob, but we got the essential point. Okay, so as people, if you'd like to raise your hand for questions, we'll turn to that in just a minute. So, all right, my last question is a tough one. A tough one actually to say as well as to answer. It's ideas that are really sort of hard to speak about. But here goes. So the Lieutenant Governor of Texas, I'm sure you saw, went on Fox News in March and caused a real firestorm because he said that he believed that many elderly Americans would be willing to risk their lives or even give their lives in order to give their grandkids a better, brighter future. That was seen as a defense in some ways of the president's view about reopening the economy quickly. But on the other side of the political spectrum, I've seen Dr. Zeke Emanuel, a friend of this organization, another Philadelphian, and a former healthcare advisor to President Obama. I've seen him on MSNBC saying what I think is in effect a very similar kind of thing, saying that there's sort of no such thing as saving lives. It's only a question of saving years of life, and that therefore the focus of policy and the focus of healthcare resources should be on younger folks rather than older folks. So I'm asking each of you not a policy really and not an economics question, but kind of a moral question about whether or not the trade-off that we're really talking about here is the future of our kids, which could be significantly impacted by a long, deep recession, even depression, versus the safety of our elderly population, which is particularly at risk to the virus. Peter, why don't we start with you?
Oh, thanks. I get to start first with the easy one. I'm not sure that's a choice that we have to make. I mean, I think that our younger generation, this is a powerful country with, we're seeing it now. I was on a call over the weekend, and I still don't even know if I got this right, but there was a researcher at a large university that quoted something like 12,000 peer-reviewed articles have been published in the last 2 months in response to the epidemic. The energy with which we've responded, the innovation, the courage of people just going about their daily lives. I thank the people in the grocery store for going about their jobs, and it's a resilient country. I think people like Bob and I can have a different point of view, but we have a different way of getting to the same place. We all want people to live, prosperous, meaningful lives in peace, and we can accomplish that without having to. The younger generation, I think, will be fine. I'm more concerned about the choices we make, not directly in the midst of this epidemic, but the choices we make long term in allowing them to inherit a country similar to the one that was bequeathed to us from the perspective of not having managing our affairs in a way that threatens their long-term well-being, economic well-being, and otherwise.
Bob?
I guess I'm going to reject the premise of the question in the following sense. We all die. And if we just felt that it would be more economically efficient so much money on Medicare, why are we spending money on nursing homes? Why don't we just tell people that it's time to die? And the Wall Street Journal editorial page has come very close in a kind of Jonathan Swift way to embracing this point of view. I think if we had adequate planning for this crisis and had adequate and more efficient outlay on healthcare, these are awful choices we should never have to make.
Thank you. Thank you both. All right. I'm going to recognize a first question from Art Hunt. So Art, if you would unmute.
Thank you. So this is Art Hunt. I'm in Hamden, Connecticut, and I'm wondering what it means to have testing on a massive scale. How high does testing have to scale to be useful? And how reliable is testing, both as testing for infections and testing for antibodies?
Go ahead, Bob.
Well, that's exactly the right question. I think the most secure way of knowing when it's time for the economy to get back into high gear is when we test enough people to find out that there is sufficient antibodies in the population as a whole. And I agree with Peter. I think the private sector and the public sector are very rapidly developing these kind of tests, and they need to be utilized very, very rapidly, because that's the safest indicator of when it's prudent to get the economy back on track.
Art, thanks for the question. And you're in Hamden. I grew up in West Haven. We were your arch rivals, particularly in hockey. But anyway, the only thing I'll add is one of the things I wish was happening now that we have testing, still not where it should be, but at least testing for infection at a much greater volume than it was several weeks ago. I wish we were allocating some of that testing capacity to do some random testing to figure out a little bit more about the disease, about how widespread it may be, what implications that may have for the actual mortality rate, et cetera. I know we are still strapped for testing capacity, and tests are being reserved mostly for people who show up at a healthcare provider with symptoms. But I wish we could learn quite a bit by using a fraction of one day's testing to test folks randomly in a careful way, and we'd learn quite a bit.
Okay, Karen Shapiro, you are up next.
Oh, goodness. Hi, sorry. I walked away from my screen. Just wondering if you can talk about issues related to opening borders, U.S. borders. What considerations do you think are relevant to that? When do you think that will happen? Just that general issue, if you could talk to that, please. Thank you.
My family vacation in Europe in June is probably off the table. I think, again, it has to be dictated by the spread of the virus we're going to have and what's going on in other places in the world. That's another reason why I'm not expecting the proverbial V-shaped recovery, because the virus is going to be moving around different parts of the world at different times, and we're going to be in a position much more quickly, I would think, to reopen portions of our economy than to reopen all of the borders. I will say, not in direct response to your question, but one of the things I am really concerned about is that the virus will have a backlash on the free movement of goods and people around the world. And I am worried about that. I think one of the things that we could do for our economy is to really get rid of the tariffs that we still have, and the ones that we've erected anew over the last few years, as well as I'm concerned that this is going to have create a backlash against a more open immigration system, a more liberal immigration system where we allow for more legal immigration, which is something that we advocate for. I think it's interesting to note that one of our researchers determined that about a third of the essential workers still at their jobs in California are immigrants. So the contribution they're making in the sciences, in performing those essential roles, has been very important in allowing us to confront this situation.
I would just very briefly add, Peter and I are in accord on the need for a more humane, liberal immigration policy. I think where we disagree is on some of the trade issues where we let the supply chains become so dominated by China and to a lesser extent India that almost all of our pharmaceuticals and our medical devices are reliant on a country that does not wish us entirely well. And I think this is going to force us to revisit that.
Okay, we have a question from Steve Tarzniski.
From Santa Monica, California. Should health insurance continue to be linked to employment? Thank you.
Who wants
Not
to?
in my view.
I think it's one of the original sins of our healthcare system. I think when it became linked to employment as a way to get around wage and price controls in World War II, and then was allowed to be given to employees without being taxed, I call that the original sin of our healthcare system, because it created a situation in which employers were basically forcing more compensation into the health insurance that they were benefits because they were not taxable, and that would be fine for the employee as well, since they'd be paying tax on cash compensation and not their health care benefits. And that's what really changed our health insurance system from an insurance system to a third-party payer system. And to me, that is the one of the very important factors in healthcare inflation. If we had a system in which most of routine healthcare was something we were paying out of pocket, you know, the analogy I always think about is if we had done a similar thing for auto insurance, you'd be getting your auto insurance from your employer as well, and it wouldn't just cover a collision, it would cover, you know, your oil change. And since you wouldn't care what an oil change cost, they'd charge you $500 for it because it would go to, the bill would go to your insurance company. That's one of the things that we've done with healthcare. We've removed the consumer control from how healthcare dollars are spent.
I thought Peter and I were going to agree for a moment. I mean, I hope that when this crisis is over, we will delink health insurance from employer coverage to universal citizen health insurance. And if you look at where the inflation is being driven, you know, it's not people being too frivolous about what they go to the doctor for. It's all the high-tech stuff. It's people living longer, and it's all the price gouging by all the middlemen in the health industries that are making the United States a much more inflationary health system than countries that do have universal health coverage. So we could have a whole other debate on that question.
All right, we're going to take one last question from Sean Bray. Sean, if you can unmute.
Hi, I'm Sean Bray. I'm from Haddon Township, New Jersey. We've spoken a little bit about, you know, reviving the economy in a sort of vague way, getting GDP up. But what will that economy look like after this crisis? Will there be any significant changes in the structure of the economy, say like an increased emphasis on telecommunications, internet business, or maybe changing attitudes towards globalization?
Great final question.
I think there will be changing attitudes towards globalization. I think there'll be more of a focus on domestic production. I worry, and maybe Peter and I can agree on this, that there'll be a lot more concentration, that a few big companies that have been monopolists, especially in the tech industry, but also in the pharmaceutical industry and other industries, the survivors and the banking industry as well will have even more concentrated monopoly power. And that's another thing we're going to have to really take a close look at as we come out of this.
Sean, thanks for the question. I've already expressed that I am concerned about there being a backlash against globalization, and I think it won't be a well-founded one either. If anything, I think that you know, people worry that so much international travel encourages the spread of viruses and creates pandemics, but the flip side of that coin is that we actually develop exposure to a lot of germs through the you know, wide-ranging movement of people around the globe. So I do worry about both the impact on trade and the impact on migration. It's always very difficult to predict. As I said, we're one of our strengths is that we're a very innovative country. We have a lot of very talented entrepreneurs here, and I think that there are a lot of things to be concerned about as we recover, but there are going to be some exciting things as well. There are going to be some new businesses that we haven't even thought of that come out of the experience that folks have here. And I think that that's something that we'll all be excited to see in the future.
Thank you. As we adjourn this evening, let me say thank you to World Affairs Council staff, particularly Haley Boyle, who's been operating the back end of this platform. Obviously, want to thank Bob and Peter and all of you for your participation. Please let us know what you think about this sort of event, how you think we can make it better as we go forward. We have 2 more webinars scheduled that are open for registration right now, and quite a number of others that are in the pipeline on important topics that you'll be receiving word about shortly. So please come back and please tell your friends. And in the meantime, everyone, please stay safe and healthy. Thank you and good night.
Thanks, everyone. Thanks, Bob.